Again, thank you for the invitation here to Santander, and it's really a distinct pleasure to present to you what is the issue of efficiency in general, and I would say more in particular in Europe. When we talk about efficiency, efficiency has a particular meaning, not only in English, but also in all our societies. And essentially is a very simple concept which says to produce a specific outcome effectively with the minimum amount of or quantity of waste, expense, and unnecessary effort. So essentially doing the best with the less. And when we are starting to think about efficiency, the first things that everybody is thinking, and this is particularly true for our hospital administrator and politicians, because those are the ones who are requesting more and more frequently or exclusively efficiency to our system, you see that efficiency usually is very easily done when you cut cost. So by cutting cost, the people say, well, I have done a good job in making this one more efficient. But what the people, they don't get is the complaint. And usually, you as a doctor, you take the complaint, and the politician are getting the applause because they have been able to save money from the system, and the same is for the administrator. So this is something that we have also to be very, very careful. And indeed, efficiency by itself says nothing about the activity moral content. And again, we as a doctor, we're at the forefront, and we have to take the responsibility about the complaint of that. Now, if you look at efficiency in Europe, the situation is particularly diverse, is very heterogeneous, and you also recognize that there are probably at least three different levels at which efficiency may come to. The first one is about general issue. So when we're talking here, this is equally true in every nation, no matter what's in Spain, or is in Ukraine, or is in North Africa, or in North Pole. The general is about the therapy indication and the appropriate use of the therapy. And this has to do with guidelines implementation and awareness. So I think we have a very nice talk after my one, so we'll certainly discuss more in depth that one. But it's not only a matter of guideline awareness and implementation, but it's also really the appropriate selection of the patients and the appropriate device selection, which is also quite important. At the same time, you see that it's also a matter to really to avoid what we call the number of off-label indication, because those are the one in which probably less evidence is. So, but also in general, we have a significant healthcare system heterogeneity in Europe, and this is also our challenge in general, but also maybe also the good of this. So then we have specific country issue, and this is healthcare national organization, and this is here really the problem, and I will spend some time in reviewing what is really the currently available infrastructure and to bring those one until the saturation point. But in general, there's a lot of discussion with the centralization of services. It is probably worth, and you may or may not know, but in Italy there is a significant effort to cut the number of centers available just to increase the efficiency. So then, and this is another thing that we do not have I would say, in the vast majority of a European country, is the quality control system, because efficiency is good, but also the outcome of a patient is particularly important. And efficiency also goes with reducing malpractice. Malpractice because, medical prescription or inappropriate or diagnosis or procedure-related complication immediately come into the extension of a patient's stay, but also in recurrent hospitalization related to the procedure. So this also a significant part of our efficiency in the system. And again, in Europe, there is not a very good homogeneous system at all, but is even not well-defined in the vast majority of the nation, the system. Healthcare reimbursement and healthcare technology assessment is becoming more and more an important issue. NICE, in UK, is particularly proactive not only to look at the scientific evidence, they also look at certainly at the quality control, but also they look whether the society can afford. And this is really where also efficiency is particularly relevant. But also what we usually forget about efficiency, and this would be also part of my presentation, is what happened in our society, in nations, and looking at the evolution of population, how demographic changes may change or are changing over time. And this has a lot to do with social acceptance of our therapy, in particular for ICD, is particularly relevant and significant. Because then, at the end of the day, it is a matter of philosophy, but it's a matter of social acceptance, whether we may accept that at a certain age, we let the people to go, and we don't take good care of them by providing a very expensive therapy. So the question is, at what point in time our society is, say, stop to an ICD, because, say, the number of years that these patients may be saved, it is really not worth, or has too high cost, poor quality of life. And then we have a sort of regional and center-specific issues, and this has something to do more with the workflow of each hospital. This is something that we cannot control at European level, but certainly every hospital has a lot of opportunities, and I think also technology today is really the one who really may help us very, very much in improving that, and I will show you also a few about this. So I'm taking numbers out of the ERA White Book. This is a book has been coordinated by Fernando Riba, to whom goes my deepest thanks and really appreciation for the work that he has done. You can take a copy of this one at the ERA booth we have at the exhibition, so feel free to go there and to take this one, which is essentially an analysis of all the data published over the last few years. And again, I use in particular two fields. One is CRT devices with the defibrillator component, and also one pertaining to my talk is the ICD, obviously. As you see in the White Book, we have not only the current data, but also we have past data, and this are very helpful to show and to look into the evolution. So we also have, and this is very interesting, is a sort of very, very brief summary, and these data or these remarks are given to us by the chair and the national coordinator of the White Book, who sent us the feedback whether in each nation there are specific issues related to guidelines. But again, guidelines is also a matter of efficiency of the system. So if you look here, and I took 3 different examples because these may really cover I would say, the broad spectrum of heterogeneity we have in Europe. I took Belarus, I took Germany, and obviously Spain. Well, if you look at this one, the question given to the national White Book coordinator, which is usually the president or the co-chair of a national working group, says very simple. We have a lack of a center, and you have a 1 for no, and 5 is really we have a great obstacle, so we have a great need of having more center, lack of reimbursement, lack of referral, trained personnel, awareness, guidelines, and operators. So if you look at this picture, you will say that probably Belarus is the one where you have really the greatest need in all of the vast majority, and Spain looks like more or less an El Dorado, because, very similar to Germany, is very similar in many ways. So the only things that the people here complaining that don't have enough trained personnel. Now, this is the situation we have these days. This is data for the 2011, so the 2012 is going to be published soon at the Europace in Athens. So you can really, very difficult have to see where Spain is, but Spain is here. And this is, you see, this is for the median and the mean number for the implantation in ICD per million inhabitants in 2011. Apart from San Marino, which is a particular situation, so don't take this one as really the example, But Germany, in general, has about 320 devices, ICD, which are talking about only ICD, not CRT, per million inhabitants. And again, Spain is in the range, or was in the range of 74 per million inhabitants. And the mean European, which covers 45 countries, although ESC covers 55, is about 105. Now, if you divide all the different nations in quartiles, and you can do this one, you see that Spain belongs to the second quartile, so essentially is one of a relatively low implanting number of countries in Europe. Now, another way of looking at this one is, number of devices are usually related to number of centers active. And what we have done, we have taken the next step into looking at this one, so try to correlate what's happened with the number of centers and with the number of implanting or implanted ICD. So, and another way to read this one is that essentially when you have an increase in the number of devices, whereas the number of centers remain the same, indicates that two nations are using more efficiently their facilities, because essentially they do, with the same number of centers, they do more. So they maximize really the amount. And you can see that this is, again, this is the situation for Great Britain, Portugal, Netherlands, Czech Republic. You see that with the same number of, more or less the same number of facilities per million inhabitants, we are doing Czech Republic 3 times more than Portugal, for example. Spain is here, and you see Spain is in the lowest part compared to Austria or Israel or to Finland. The other way to look at this one is also that if you take this other axis here, this is essentially is the number of devices done, say the number of a center which are doing a number of devices. And in other way, this is also a way of measuring healthcare system efficiency, but also this is quite important because at the end of the day indicates how strong is the referral in your country. So, and also, if you may understand that this is another way that we have to look at competence acquisition and maintenance. Indeed, if you come below a certain number of devices per center done, you cannot keep your competence. So this goes into the quality control issue. And this is another way of looking at this one. Now, if this is just the other way, where this is again, please forgive me, but this is the number of implants rate, so it's the other way that you have seen the previous chart. So this is 2011, Spain compared to the ESC country. You see that the number of centers compared to the ESC country seems to be similar. However, the number of done devices is much lower compared to the ESC. But, if you just take one single point in time, may not be meaningful. You have to look at what is the evolution of all these. And the evolution in Spain is particularly interesting. What happened here is since 2007, 8, 9, 10, and 11, you see that what happened here is that the number of centers incredibly increased, whereas the number of devices has been really little changed. So meaning that essentially you have a disproportional growth in the number of facilities doing compared to a relatively modest growth in patients' referral. So, and this is really the way in which now, again, don't take me wrong, I don't want to blame, but in which a system is not effectively and efficiently working. Now, it is just for ICD? Unfortunately not, because when you take this one and compare to ICD, to CRTD, and to ablation procedures, you can see that, this is for ICD, this is for CRT-D, and this is for ablation. Ablation looks even more dramatic in the number of centers which has been opened and doing, but you see that you have a very, very, very modest increase in the number of ablation. Again, this is something that should be reflected, at least at the level of this meeting, as well as within the European Society of within the European Society of Cardiology and within the Spanish Society of Cardiology, and to make a reflection on that before politicians start looking at this data and they request you to make substantial changes in the way you are doing things. Now, what is about the comparative assessment between Spain compared to other countries? And again, going back to Belarus, going back to Germany. This is the situation for ICD. Again, over the years, you see that Spain is there. In Germany, this looks significantly more proportional in the number of the centers which has been further opened up in Germany and reflected into a significant increase in the number of procedures. In Ukraine, this is the situation is much different. In Ukraine, if you see, you have a sort of horizontal growth, which means that in Ukraine you have a very, very efficient system in which few centers are greatly moving in the number of people, and also the referral process has been very, very strong. And this, obviously, this is a situation which strongly contrasts what the people give us in terms of a feedback. Because if you look at what now in Spain the people think about the system, it seems that there is no need of opening further centers. There is no need of creating more awareness around the guidelines, and there is no need of, say, the slow lead of operators. Again, these numbers say totally different things, but it is not only for Spain, but also in Germany. You say we have no lack of centers. Despite that, you have a double number of centers since over the last 4 years. Again, this is something that we have to really consider very strongly. There's another very important aspect which is related to this one, and this aspect is essentially related to population changes over time. So what I plotted here for you is the evolution of a population over the last 10 years in Germany, in Spain, and this is in Belarus. In Germany, there is a significant reduction in the number of people, of inhabitants in the country, and the same applies to Belarus. So people are emigrating. And the reflection of this one is essentially that this increase in the number of centers may be the reflection of the fact that you have less people, because, you know, this is a number of centers per million inhabitants. If the number of inhabitants is going down and you have the same number of centers, this number goes up. But I can tell you that in terms of absolute number as well as in relative number, this has happened, that Germany has increased the number of centers significantly, but also there is also a significant reduction in the number of inhabitants. In Spain, you have a significant growth in the population, meaning that, again, you still have a huge mismatch between the potentiality and what you're doing, and the same you see in Belarus, you see the same trend as we have in Germany, with, again, the difference, again, that this country is moving in a different direction. Now, what's happened or what will happen in 20 or 30 years from now? This is very important because, you know, this is where the politician looks. They have a time horizon of 20, 30 years. And this is where now the situation is becoming scaring. Because what you have, and again, this is for Germany. In Germany, in 2003, this was the distribution of population for men and women. In 2013, this is what you have today in these days, or expected this year. This is the 2033, and this is the 53. There are two important things here. First of all, if you look at the number of people, inhabitants in Germany, is going down. But not only is going down, but also they are aging. So you see that the pyramid here is moving toward the 70 and 80 in 40 years. So, which also poses the question that in terms of infrastructure, you will get an overcapacity in infrastructure. And also, there is probably, unless you do an adjustment in the limit of indication, but also what you have here, you see that you have a decline, and we're expecting a decline in the number of implantation, and this would be made by the politician for sure, And then in 2015, you will have a significant drop in the number of inhabitants, in the number of procedures, but also in the number of centers. On the other hand, in terms of cost effectiveness calculation, meaning that over the years, we will see changes also, and we will have a continuous reevaluation, but also we are expecting to have a significant conversion of RCD eventually in CRTP. I think that's what will happen, and probably in CRTD. And there is another very important issue here, that you have an increasing number of associate procedures, which will make a tremendous increase in the cost effectiveness of per patient. Then also another very, very minor point is about the significant discrepancies between the number of ICD versus single chamber versus dual chamber. You see that for reason that people do not understand, there is no reason, there is no related either to the gross domestic product, is not related to the healthcare system, is not related to the number of population, is not related to the indication. You see that the number of ICD is significant diverse. You have some centers who are only doing single chamber, and there are some others equally, I would say, poor country like Armenia, which is doing mostly dual chamber ICDs. So this is also another way of looking into efficiency, because the cost of one device to the other one is maybe substantially different. Finally, let me close about this one. Just 2 slides to show you how current technology may help in promoting and making efficiency possible. Everyone knows that the number of devices has been growing and will continue to grow, and is a list for the next decade. One of the important things related to this one is the efficiency of the follow-up of our systems. And here we have really the major possibility then that using technology, and in particular remote monitoring, can help. Now, ERA, together with the EUCOMET, which is the European organization which includes all device companies, has set a paper, a white paper, which looks at reimbursement of telemonitoring. And this is a very important paper, because for the very first time, this paper is not directed only and exclusively to physicians, but is directed to your government. So this is a very different way of dialoguing, and in which the national working group now can take advantage of what we have found here, and to present to the politicians and say, if you want to do saving, it is fine, but the saving can be reinvested in technology, and by using the right technology, you can create additional saving. And this is exactly what we have. So we have done this one because we know that the funding for remote monitoring is significantly complex and very different in different countries. There are some countries in Europe in which we have some reimbursement, some other in which certainly is not. And one of these is certainly Spain. So what we have done, and I would really encourage you to take this paper just for reading, and for Angel Moya and his working group really to present to the politicians and to discuss about this one. So we have created 2 different scenarios. One scenario is to do things differently, but also to do different things. So in other words, one is related to the fact that you can replace with remote monitoring, you can replace the physical in-person follow-up, and the other one is doing essentially, if you like, disease management. So this is the 2 different ways. And by using these 2 different scenarios, you can clearly show that by taking remote monitoring, you can really save money. In other words, if you take the money out for the follow-up, then you can invest this money into really supporting more investment in ICD, for example. So the situation for Spain is the following. Again, this white paper has been presented to the Spanish Association of FENIN, and we hope that this meeting will come, and we hope that also that the National Working Group is taking the opportunity of really presenting this paper to the politician and say, we can have and we can offer you a solution. So in conclusion, there is significant heterogeneity in the efficient allocation of resources in Europe related to ICD and probably to all EP procedures. And we know that one size does not fit all, but we also see long-term analysis of healthcare system efficiency need continuous assessment given the changing of a target population, expansion of indication, but also changing in the demographic. Patients awareness program, it is, to me, is the most important thing. We need to increase the referral from the general practitioner, from general medicine, to electrophysiologist, because this is the best way to increase the efficiency of our activities. And also to reduce the inefficient use of resources or currently available infrastructure. And also carefully scrutiny of appropriateness of device indication, quality control, and critical threshold. This is very important that national working group take an action here before politicians may do that. And I would say, really as a message, be proactive in auto-regulating the field before someone else does for you. And the request, then the saving operated in VP field will be reinvested in the same field. I think this is really the most important thing that we like to see, is to me key to all this one. Thank you very much for your attention.